morning, ladies and gentlemen. Thank you so much to Neauvia for the kind invitation. This is Rhinofiller also, and today in 15 minutes, we're going to speak about a really interesting topic represented by non-surgical remodeling of the nose. The nose play a key role for the facial aesthetic balance, and the really important thing is to understand that the nose is not a sharpless subunits, but is characterized by some anatomical subunits that give us a pleasant and natural result. For example, looking at this picture taken from Instagram, we can see that the concept is not really clear to everybody, because usually the approach for the non-surgical remodeling of the nose is characterized by a reduction of hump perception. But in these cases, as you can see, there's just an hump elongation. So those are not natural results. Before to understand the best way how to approach, how to inject, it's really important to know that the nose is characterized by a big vascularization taken from the external carotid artery. But the main interesting thing is that the internal carotid system and the external carotid system are connected between each other thanks to the arteries that comes from the dorsal hump and goes to the supratrochlear artery. So this is important to let us understand that when we have to inject into the nose to avoid embolization, it's really important to inject touching something that is represented by the bone or the cartilage. About the innervation of the nose is carried out by the trigeminal nerve, and of course we know that as many arteries we have also so many veins, and this is important because in the choice of the filler to be injected, it's important to think about also the capability of vein compression carried out by the filler. When we have to remodel the nose, we have to know that we have to modify bony and cartilage architecture. So we have to be able to identify bone and cartilage without removing the skin, as in this cadaveric specimen. It's important to know that the upper third of the nose is represented by the bones, the nasal bones, the middle third by the ULC, the so-called upper lateral cartilage, and the lower third by the LLC, lower lateral cartilage, that are divided in medial crura and lateral crura, and medial crura and lateral crura are connected thanks to the dome. We can see that the cartilages are also connected between each other, like in this case, we're looking the connection between the ULC and the lateral crura thanks to the so-called scroll ligament, or for example, in this case, just detaching the ligament between the medial crura, we can see the septum. The interesting thing is that the septum is completely hidden from the upper part to the lower part, from the bones, and then from the ULC and the LLC. This let easily understand why when we remodel the nose without surgery, there's no way to have functional improvements. In my hands, I love to use Neauvia Intense when I have to give big projection, represented mainly by the injection above the anterior nasal spine that let us to achieve projection and upward rotation of the tip of the nose. And the second side where I prefer to use this kind of filler is represented by the radix, so the frontal nasal angle. But when I have to remodel the tip of the nose, I prefer a filler with a lower projection effect, because we know that the tip of the nose is really vascularized. And so if I inject a filler strong in the brackets, I can have vessel compression. This is why always when I approach the tip of the nose, I prefer to inject with intense rheology. Usually my plan started identifying the so-called key area, that is the area of connection of the ULC and the nasal bones. I trace a line passing through this point so I can understand how much I have to project the tip and how much I have to fulfill the radix. Usually the first step is always represented by the injection above the anterior nasal spine, and the anterior nasal spine is the most projected point of the premaxilla and is the area where lay down the feet of the medial crura and the septum. Thanks to this kind of injection, we can reach projection and upward rotation of the tip of the nose. The second step is always represented by the injection above the radix. In this case, it's really important to know that we have to pinch bilaterally and then inject. The pinching maneuver is really important because reduce the risk of lateral displacement of the filler that can give a really unpleasant result called the avatar effect. And another really important thing, when we inject above the hump or above the radix, it's always really important to touch the bone, because as we can see, we have a very big vascularization in the nose. And so if we inject touching the bone, we are sure not to inject into the vessels, and so to avoid embolization. Then at the end of the injection of the anterior nasal spine and the radix, I can start looking how to ameliorate the tip of the nose. If we have some site injection characteristic, for example, the columella, when we have the so-called hidden columella deformity, we can just release a linearly hyaluronic acid from the anterior nasal spine to the tip of the nose. And you can see in the middle picture, the green draw that represent the so-called plumping columella graft. And this helps us to have more projection to the tip of the nose. Another tip is to inject just above the tip, the so-called only tip graft. In this case, we have to inject really small bolus, and it's really important, this kind of injection, because will give us the so-called supratip break. The supratip break that is pointed by the red arrow is really important for the aesthetic balance of the nose, because if there's no interruption between the dorsum and the tip of the nose, we have the so-called drooping effect of the tip. If there is a separation between the dorsal area and the tip of the nose, we have the so-called supratip break that gives a really aesthetic advancement. This kind of injection, I mean, just between the two domes, could be really useful also when we have condition like this one, where the lateral crura is laterally displaced. In this case, just a little amount of hyaluronic acid. Let us, in this case, I love rheology, to inject, will let us to achieve this kind of result. And this is another example. You need really a small quantity, a small amount of hyaluronic acid, and you will have a great effect for your patient, and it's also really, really long-lasting. And last but not the last, there is also another side injection represented by the alar rim. This is also called the ring graft. But telling the truth, this kind of injection could be really dangerous, because here we have a lot of vessel, the rim artery, and it's not so easy to inject touching the cartilage. So if it's possible to avoid this kind of injection, is better. But if you are able to perform this kind of injection, you can see how more defined is the alar rim. So just to summarize what I have said, usually I always start injecting the anterior nasal spine and then the radix, and usually I just inject intense. But in the case I have also to remodel the tip of the nose, I prefer to use rheology. And of course, if I have to remodel the whole nose, I usually do not open 2 vials and just to use 0.3 of intense and 0.2, 0.3 of rheology. In this case, I just open 1 vial of rheology. Of course, when I'm injecting above the anterior nasal spine and the radix, I will get less projection with the same amount of hyaluronic acid, but in this way, it's just a matter of volume. I have just to inject a little bit more, taking care about the tips I told you. And of course, you never need more than 0.7, 0.8 ml to remodel the whole nose. But I want to focus about these 2 patients that are totally different. For example, on the left side, I just injected above anterior nasal spine and the radix. On the right side case, I have also to inject the tip of the nose. Why? Because it's easily to note that preoperatively on the left side, we already have the so-called supratip break. So there's no mean to inject above the tip of the nose. In the second case, on the right side, we can see that there's no supratip break. This is why after the injection above anterior nasal spine and above the radix, I have also to remodel the tip of the nose. Another case with a good nose preoperatively that the request was just to have a little bit more projection and upward rotation of the tip. Another case with this 42-year-old lady that was asking just to solve the drooping effect of her nose. So in this case, I just injected above anterior nasal spine and above the columella. And as you can see, drooping nose are the best case to be treated, but also when we have moderate HAMP with a good preoperative plan, we can project the tip of the nose in the right way. The key is the projection on the lower part of the nose. As much we projected, the lower amount of hyaluronic acid we have to inject above the radix. And now let's see together this short video of this 43-year-old man that was looking for an ameliorate the aspect of his nose. As I told you, I always start with the injection above the anterior nasal spine, and I pinch bilaterally because this is a painful maneuver. So pinching, you reduce the pain. You have to go perpendicular, touch the anterior nasal spine, and starting releasing small bolus of hyaluronic acid. In this case, the amount usually is 0.2, 0.3 ml, so it's a big amount, but I suggest to release small bolus just above the anterior nasal spine. You can see there's no big bleeding because we inject above the bone. Now, the second step is to inject above the radix. Remember, perpendicular injection, pinch bilaterally to avoid lateral displacement, but remember, never inject in the soft tissue. You have to inject touching the bone. You need a wall to be sure not to have an embolization. Now, this is the so-called spreader graft. It's not so easily, it's for trained physicians, because the concept is that you have to release hyaluronic acid filling the ULC behind your needle. It's not easy. There is a specific maneuver, and this procedure is performed to ameliorate the bridge of the nose. You can see now on the right side, I go perpendicular. I touch the lower part of the ULC. I rotate my needle, filling the ULC, and then I release hyaluronic acid. And last but not the last, only tip graft, some really small bolus between the 2 domes to achieve the right projection, the requested projection of the tip of the nose. And this is the result, the frontal view, and this is the result in the lateral view. So as you can see, just following a flow chart of side injection, you can really achieve good result without surgery. Thank you for your kind attention.